Hi, I'm Bernadette with AD Surgical, and today I want to introduce to you one of our best-selling wound care products, silicone foam dressing. AD Surgical silicone foam dressing are sterile, single-use dressings made with a highly absorbent foam pad, protective film backing, gentle silicone adhesive, secure border. They are used to protect and absorb exudate from the wound, which helps facilitate and moisten healing environment. Silicone foam dressings may be used for the management of mild to moderate exuding wounds, including post-operative surgical wounds, pressure ulcers, diabetic, venous, and arterial ulcers, traumatic wounds such as skin tears, road rash, and minor injuries, lacerations, and abrasions. Silicone foam dressings should not be used on third-degree burns and lesions with active vasculitis. Dressing application. First, cleanse the wound area thoroughly with the appropriate agent such as saline solution. Be sure to dry the skin surrounding the wound. Next, remove the dressing from the packaging. Choose the correct dressing size. There should be a 3/4 in overlap onto the dry skin surrounding the wound. Apply the adherent side to the dressing over the wound. A secondary dressing or additional fixation is not necessary. Dressing removal. All dressings should be monitored regularly. Remove the dressing when indicated. For example, visible leakage or drainage on edge of the foam pad, increased pain and swelling, after a maximum of usage of 7 days. Carefully remove the dressing by gently lifting the edges off the skin. Dispose the used dressing in the appropriate waste reciprocal following the approved guidelines. Thank you for watching. Visit www.ad-surgical.com to learn more or call 888-841-8481 to order.